Hello, this is Don Self. Today we're going to talk about Medicare annual wellness visits. This is about an 8 to 10 minute mini webinar. Most people have no idea that more than $300 profit per annual wellness visits are easily obtained if they're being done correctly. The problem is most people do not do Medicare annual wellness visits the right way. That's probably because most practices don't exactly understand what a Medicare annual wellness visit is. And some believe it to be an annual physical. In fact, most patients think that. A lot of doctors think that. They think there has to be an exam, there has to be EKGs, there has to be some medical decision-making going on. That's not what a Medicare annual wellness visit is. Some believe it has to be performed by the physician or the nurse practitioner or PA. No, it does not. Some believe it includes EKGs and lab work. Now they're getting it confused with the Welcome to Medicare visit that's only payable once in a patient's lifetime, right after they get Medicare. Some schedule it during their sick visit with the patients. Bad idea. They're losing money and they're not doing everything that they need to be doing because they're concentrating on the illness or the acute problems. A Medicare annual wellness visit is also called a PPPS. That stands for Personalized Prevention Plan Service. Personalized is the key word there. Medicare came out with these back in 2011. So we've got about 5 years or 6 years of experience on working with these Medicare annual wellness visits. And one of the things we got to make sure we understand is these have to be personalized for each patient. You cannot just give the patient a complete list and say, we want our patients to get a colonoscopy every 10 years. We want a mammogram every 5 years. We want a DRE every 3 years. No, this has to be personalized, a written screening schedule personalized for that patient. And that's why so many practices that's doing these are going to be audited. And when they're audited, they are end up having to give money back because they're not doing it the right way. And doing it the right way is really easy and extremely profitable. Now, the two most common reasons I've seen practices fail audits on Medicare annual wellness visits. One, they're not doing a verifiable cognitive exam. They just say, did a cognitive exam on the patient. They're not going into detail of how it was done, who did it, how long they spent doing it, etc. There's an easier way of doing that and documenting. The other one is there's no personalized written screening schedule for the next 5 to 10 years handed to the patient before the patient leaves. If Medicare calls up the patient and says, well, you handed a 5 to 10 year screening schedule showing you when the doctor wants you to have a colonoscopy, when the doctor wants you to have a mammogram, etc., the patient say no. Bingo, the doctor's fails because there was no written schedule handed to the patient. This is the heart of the entire preventive medicine goal for the annual wellness visit. The purpose of it all is to let the patient know exactly what Medicare benefits they're entitled to, what tests they should be getting, what services they should be getting, and when they should be getting them. And that's not what we're doing when we just bypass this part of the service. The intent of the annual wellness visit is to identify and reduce health risk. There's 27 different health risks that's being assessed if we're performing the annual wellness visits properly. Most physicians, when they're doing the annual wellness visits, do between 10 to 14 health risks. They're missing too many things and are not capturing what they should be. And that's sad because they're not identifying or they're not treating the patient. They want their own family members to be treated. Some of the health risks that we're talking about right here is, does the patient have any kind of allergies? How are those allergies being treated? What is their BMI? Are we addressing their BMI? Is that a problem? Cardiovascular disease, what kind of exercise? Does the patient have any kind of hearing problems? Does the patient have high blood pressure? How is that being addressed? And not just with drugs, but with stress relieving techniques or with exercise, etc. Or is the patient at any risk at home under home safety or from anybody else in the family member, caregivers, etc.? Does the patient wear a seatbelt? Is there any kind of mature driving safety problems? Does the patient have vision problems? Are they abusing or are they using alcohol or tobacco? And if so, is that a problem with the patient? Are they abusing it? Are we doing an alcohol misuse screen during the Medicare annual wellness visit? Are we doing a depression screen during the Medicare annual wellness visit? Are we doing any cardiovascular therapy during the annual wellness visit? What are we doing during the annual wellness visit that Medicare wants? Well, we have to be identifying 27 of these health risk summaries if we're doing everything Medicare wants us to do. Now, Medicare annual wellness visits can be performed once a year. I generally recommend all of my providers, all of my clients, They call the patients and schedule them to come in every year during the birth calendar months. That way we know it's been at least 11 full calendar months since the last Medicare annual wellness visit. They won't be denied. I also show the practices how they can find out whether the patients had a Medicare annual wellness visit from another provider. That's as simple as logging in on the computer and doing it on a program. Now, the entire service can be performed by a licensed provider. Licensed provider would be a LVN, LPN, or RN. Yes, a physician can, a nurse practitioner, PA can, but that's not what I recommend. An MA is not a licensed provider. They're certified, they're credentialed, but they're not licensed, so they don't meet Medicare's guidelines in that. And having a physician do it is a waste of resource. A physician's time is worth well over $400 an hour if you're working smart in your practice and doing everything that should be done, especially following the Incident 2 rules. Having a $420 an hour provider, that's what their time is actually worth, doing something that a $20 provider, such as an LVN or an LPN, could do, is kind of foolish. Now, can an MA do most of the work? Yeah, and then the physician or the nurse practitioner or the PA come in at the end of the visit and the patient to report. Yeah, but you just got to make sure we're still doing everything during that annual wellness visit that Medicare wants it to be done. And you're documenting who is the person handing the patient the reports. Now, I talk a lot about Medicare because annual wellness visits are not just Medicare, by the way. They can also be done on some commercial insurances. United Healthcare came out last year in January of 2016 and said they wanted this done on adult patients on a directive. Wow. What about Blue Cross, Aetna, Cigna, the other carriers out there? They're finding out that Medicare is capturing illnesses and problems before they get to be at a catastrophic stage or chronic, what's the word I'm looking for about here? Stage critical care stage, and it's a lot cheaper to take care of problems at that stage than waiting until they become critical care. Now, performing the annual wellness visit correctly also helps the doctor meet MACLA and MIPS that we have this year. 2017, we have MACLA and MIPS that came in, and what you do this year affects your income in 2019. What you do in 2018 affects your income for 2020. And if you're meeting MACLA and MIPS in 2017, and you're doing it the right way, that means you're going to see an increase in your Medicare allowed amounts from 2019 of 4%, or if you're doing it really the right way, 12%, or you might even go up to 22% if you're part of that top 25% of the reporters. That's not going to be that difficult to reach the top 25% and share in that $500 million bonus. Now, if you're not doing it this year the right way, which if you're not doing annual wellness visits, I can almost guarantee you, you're not going to meet MACLA and MIPS. That means in 2019, you're going to be getting a 4% reduction. So there's advantages of doing the Medicare annual wellness visits the right way. First advantage is patient care. Second one is financial. Now, what do I recommend? I recommend you have a nurse that is tasked. It may take more than one nurse. It could be you have a nurse and an MA, or a nurse and somebody without any credentials working together to call the patient, schedule them to come in. And the nurse does everything from A to Z, or their help along with their health, their MA or their non-credentialed person, helping do services over the phone that can be done and billed. That's part of the annual wellness visit. And they'll be generating at least $300 per patient profit. And that's profit if they're doing this the right way. Now, most doctors only billing out code GO438 or GO439, so the average current Medicare income on that's somewhere between $120 to $160, so $137 on average. Most practices are missing out about $204 in additional profit. And that's sad, because if you got, say, 500 Medicare patients, that's an extra $150,000 a year in income you should be getting by having a nurse do this, a nurse generating that kind of money for you in your practice. And the nurse can handle 500 Medicare patients. They may need an MA or somebody to help them, make sure they get it all done right. But they can be doing that. They can be a profit center in the practice. Now, if you want more information, I have on my website, shop.donself.com, or a link to it on donself.com website, a full 1-hour webinar that goes into detail about all of these, how it should be done, the codes, shortcuts, etc. Or if you want to, you can schedule a one-on-one consult with me via Zoom with you and your doctor and your office manager and biller. I'm going to spend about an hour on the phone with you. I'm going to ask all kinds of questions. I'm going to make specific recommendations for your practice based upon your own needs. That one, you're going to end up paying me $500 if I end up helping you. If I don't help you, you're not going to pay me anything, but you're going to make that determination. Or you can buy the 1-hour webinar that's on my website. Thank you so much for being part of this today and allowing me to service and work with you.